About the snapshot. This snapshot shares research looking at mental health challenges among young men who have sex with men. The research was carried out by Heard and the University of Zambia in 5 Zambian cities and towns, namely Lusaka, Livingstone, Chipata, Kapiri, and Solwezi. Study background. In Zambia, the law criminalizes same-sex relationships. To avoid arrest and being treated differently by the community, men having sex with men hide their sexual orientation. Extra efforts to create a safe and supportive environment were important for participants to come forward and be part of the study. Who participated in the study? We were interested in young adult gay, bisexual, and other men who have sex with men being part of the study. We asked organizations working closely with these young men to pass on this information and invite them to be part of the study. We also worked with the number of young men having sex with men, peer interviewers, to help us with the interviews and to understand the young men's life stories. What was the study about? Many young men having sex with men in Zambia experience daily challenges because of restrictive law and social environment which disapproves of same-sex relationships. We wanted to understand how this situation affects these young men, how they cope, and whether they have any support if they needed it. What did the peer interviewers do? The peer interviewers interviewed all participants. They first asked them to complete a questionnaire with multiple choice questions about their mental health and well-being, use of alcohol and drugs, and their experiences with violence. After this, peer interviewer started a conversation to get to know the participant and make them feel at ease. They asked about their childhood experiences, the processes of discovering their sexual orientation and self-acceptance, encounters with stigma and discrimination, and day-to-day coping strategies, and if they had looked for mental health support. What did the peer interviewers find out? Many participants told us that they had experienced mental health challenges and felt depressed or anxious. Some had a thought about suicide because of the stress they were experiencing or because they had received negative reactions from family, friends, or at school. Many of them also told us that they had not looked for help from the health services in Zambia because services for mental health were not available, and also that they feared discrimination from the healthcare worker. Why were the peer interviewers important for the study? The peer interviewers were important because they helped the researchers with contacting other men having sex with men and encouraging them to come forward and speak about these issues. The peer interviewers provided a safe space for participants to share their stories because they understood their situation better than the researchers. For the peer interviewers, the study was also important because it offered them an opportunity to learn new skills and to contribute to change in their community by informing other people, including policymakers, about the difficulties men having sex with men are facing in Zambia. What happened with the study findings? We included all the findings in a detailed report which we discussed and shared with government officials from the National AIDS Council and the Ministry of Health, as well as with organizations who provide support to gay, bisexual, and other men who have sex with men in Zambia. You can download the report from the HEAD website, and you can listen to the experience of Wezi, who was one of the peer interviewers. You can find the clip on the HEAD website and Facebook page.